Hi viewers, I am Dr. Buvaneswari from GBR Fertility Centre and Hospitals. Today we are going to have a short information video. What is the relation between the endometrial polyp and IVF outcome? So we should know that whether it is affecting or not affecting, whether the success rate and outcome is reduced by the endometrial polyp, we should know about it. So in IVF, what we see generally number of follicles, egg quality and fertilization rate, embryo and implantation. But when it comes to the implantation, ultimately we see endometrial layer. Endometrial layer should be 3 layer and it should be clean. There should not be any fluid collection. There should not be any space occupying lesions such as endometrial polyp. So when you see thickened endometrium, if you have any doubt, we could have had a hysteroscopy before. If you have not done it, definitely we have to go through an hysteroscopy. So when we are placing an embryo, because it is very microscopic structure, and when it is placed, it goes and rests on the normal endometrium. If it is a thick endometrium or there is a polyp inside the uterine cavity or undiagnosed polyps, then implantation may not happen. Before going into the details of implantation failure through endometrial receptivity assay and gene level and embryonic level, we should make sure that there is no anatomical lesions or defect within the uterine cavity. So uterine layer is lined by endometrium uniformly all around the cavity. Sometimes when we see that there will be some focal hyper, that is a very thick bright endometrium will be there. So that has to be checked whether it is a polyp or it is just a fluffy endometrium. So this is only possible through hysteroscopy. So it is better to go through a hysteroscopy before IVF, or if you have not had a hysteroscopy, you started your cycle. During the egg collection, you can again cross check whether you have a endometrial polyp or it's just an endometrium thickening, and you can cancel the embryo transfer that time. You can freeze your embryos, and next cycle you can go for a removal of the endometrial polyp. After removal, you can go for a embryo transfer. So that is the ideal way, and also it will give more success. And we have seen patients who have a thickened endometrium, we thought there is nothing, but when we are doing a stimulation, we will be able to clearly identify when the triple layer is forming, the polyp becomes more and more prominent and it is easily recognized. Then we can plan for a hysteroscopy after egg collection and embryo formation. Transfer alone will be done after the hysteroscopic procedure. So this is how it has to be done, and in IVF we know that it is not 100% success. In that case, even any small problem or the problems which reduces the success rate even by 1%, we should make sure they are all corrected and cleared. And my sincere advice is that if you have not done any hysteroscopy before IVF, you better go for a hysteroscopy, so that many times you have seen undiagnosed polyps are there, and many failure cases after routine hysteroscopy and diagnosis, they have gone through IVF after that they had a pregnancy. So it is better to go through hysteroscopy and then IVF later. Thank you.